I think what I'll do right now, though, is just a quick kind of demo of the platform so that you can get a sense of what it actually does and how it works. But please even unmute yourself or turn your camera on, and I'm very conversational. What I'm going to start with is I'm inside of our platform. It is online, and we've done a lot of work to protect people's privacy. In some of our cases, we will collect PHI. In most cases, we don't. So we've created a mechanism for that. And we've basically, I'm skipping a few screens here just to kind of get to the part that I think you might be interested in. So this is part of what a person sees on their tablet or phone or computer when they're answering questions. And then I'm going to show you the back end, which you would have as an administrator. So this is a set of questions, for example, the ones that I mentioned in the demo, kind of the slides earlier, might be questions about their mental feelings around their mental emotional health or rating their overall health. This was preceded by a number of other questions. And then what we can do is add all kinds of, this is the loneliness screener, but then this is a part where people are asked, for example, who are the people, organizations, programs, and others that you rely on when you have problems or need support. And that's the kind of thing that people can customize in any way. So I might here say my mom, oops, I was just in here right before this. So let me do this again. So let me see if I put my dad, there we go. I've lost a node when I went back and forth. And then if I put, let's say, my doctor, and then I include my neighbors. So what we've learned is that people put their friends and family, formal supports and informal supports. I'm going to do something I don't usually do live, but I'm going to refresh this page and see if that brings my little nodes back. There they are. I lost the one on mom when I went back and forth. So what's fun about this is that when people enter these things, a little map pops up. And what I always talk about is the way that people really lean in. So when you're being asked questions like this and you're being, you're given the tablet, people tend to just really lean into it. Which is different from us being asked questions where they're answering on a clipboard or putting it in their computer. So after someone does this and it's interactive and colorful, we ask people, for example, here, who works together to coordinate care for you and your child? So that would have been on this particular survey. And with my mouse, I'm making these connections. And this is a real difference that we see for people in terms of whether they have a lot of connections or not. We almost can't predict it. I always say on a call like this, all of us on this call, if we had a crisis this afternoon, I have no idea if you have someone who can help you and whether there are groups of people who can coordinate care for you. It's very invisible. So this gives us some insight into a person's thinking on that. And then we ask, oops, I skipped the question earlier. I don't often do this. I'm going to go all the way back to it because I skipped it to try to save time, but there was a question that asked what their most pressing concerns are. So let's say that they picked childcare, food, and money. So then I'm going to keep skipping some and get back to that screen. And here we go. So it saves everything. So here now it asks who helps you with the things you need. So this is where I can really capture like, well, I've got a couple of folks helping me with some money needs that I have, and my neighbors are helping me with childcare, and maybe food. And if we can actually take these off and but nobody's helping me with certain needs, and I can find a most pressing need without any support. And so what we're looking for is this kind of configuration, and some people have a lot of support and some don't. So this helps us understand that. And then we also can ask people what kind of person this is, maybe to what degree they depend on them to help them when they need it, to what degree do they trust them to help them when they need it. And all of these things give us more of a sense of the nuanced relationships within these relationships. And you can include these or not include them. At the end of the survey, There's the possibility for you to turn this off, but you can also allow a user to go right into their own profile. Most of our providers do turn that off. They'd prefer to actually have someone see their maps and their results first with the provider and then review it on their own after. So what I'm going to do is actually go back to the back end of this. As I mentioned, most people do turn that off. They turn off the ability for someone to see it right away, but sometimes we'll turn it back on after a person has reviewed it with the provider. That means that they're given access to the data, they're given access to the resource list, but they're not necessarily seeing it without that interaction of a professional or someone to walk them through it. So those are all options. It is very customizable. What I'm doing right now is kind of going to the back end of PARTNERme, where you could come in, and this is where you're going to be able to see every node that's inside your system. So by that, I mean, it's respondents, but it's also your resources that are listed in there, and also all of the alters, which we refer to as the people who people nominate as folks who help them with the things they need. But if I go to respondents, I can kind of sort through this and see who's answered the survey or not. Ideally, these would be connected to your ID within your medical record. You can also put the person's name in here, but then you are sharing PHI. But if I pick one of these, what it allows me to do is go to their results. So you get these results the minute they're done with taking their survey. And I picked one right here that does not have a notification, but as Nick mentioned, the user can identify certain needs that trigger a notification. We refer to those as critical needs. It could be something like experiencing violence or having suicide ideation, things that you would want to know immediately. And so if a person is at home or even in clinic and they answer with those things, a notification immediately goes into the designated person email box, but it also appears here at the top as an orange tab to let you know. And so for that, that way we can really capture some of those needs immediately. The blue lines are showing high dependency and the dotted lines are showing low trust. So a dotted blue line shows that even though they're saying dad is part of my network, it's a relationship that they're highly dependent on, but don't trust to help them when they need it. That is actually one of the ways in which we identify adverse social connectedness, is people who are connected to a lot of others, but don't necessarily have trust in those others or are very dependent on them. These quick visuals might look kind of overwhelming at first, but after you do this a few times with a few patients, you can really start to quickly get a sense of what your patient is experiencing and what kind of social connectedness they have. And then we do offer these scores of things like trust and dependency, loneliness, and so forth. The one thing you might be interested in, we didn't really go into much, is the resource list. So resources come from all different places. Our platform's really flexible. We're kind of agnostic to the resources, but if you want, you can we can work with you on connecting it to a 211 or an Aunt Bertha or another system. But most of our users have a binder or their own Excel sheet of resources. So we can bring in any list of resources. We don't automatically update them, but our users will re-upload their lists as they update them. But what this allows us to do is if a person said these are the things that they need, you'll see them as lists right here. But what our users do is they come over here to this resources tab. And right here's where they can really customize this. So we do have GIS data in here. And if you have data in here on your patients' locations, you can map them as well. And you can see if patients are connected are located close to where the resources are. But this suggested for you box is really critical, because what this allows you to do is customize the resources for the people that you're working with. So by clicking this little pencil right here, it shows me all the resources in my database. but I have different ways, like by city, zip code, or their needs are tagged here. With Jefferson Center, we're working on some revisions to this to allow better filtering and ways to add to this list. But this allows us to, what we've heard in terms of feedback is that people get really overwhelmed by having a big list. So what we're trying to do here is make that list a little more customized and targeted either by the provider's preference or by focusing on their most pressing need with the least amount of social support. But the filters that we're bringing in will allow you to filter by location to those things, or things like eligibility criteria and stuff like that. And that allows you to pick the resources that you want this person to get connected to. And when I hit save, it creates a suggested for you box that's customized for them. You can actually do the same on each box, which we've learned the more you can make this less overwhelming for folks, simplified, the more likely they are to be receptive and follow through. So we're giving a lot of tools for that. And at the top, you can save these as PDFs and put it into their medical record, any of the results, or you can email it to them and email the resource list so that they have the contact information as well. A couple last things is under scores. If you have different scores or the scores that we provide on trust and dependency, you can see it a little more broken down by different people. So there's a little more nuanced information amongst these different areas of this. And you can also take any of these and bring in your own questions, and they will show up on all of this. These profiles are customizable, and there's actually two views. There's a view that the patient can see and the view that the provider can see. So sometimes we don't want the patient to see everything, more because it's overwhelming for them, rather than that we don't want to share their own data with them. But there are different views that you can customize so that you can really manage that relationship and that sharing of data amongst people. I want to pause and just make sure there are no questions or anyone wants me to repeat anything or see anything in particular for a second. And if not, I'll show you one last thing. Okay. That's good. It makes it easy on me, but I also feel like I might not be giving all the information. So that's the member profile. And over here, you're going to see, let me go back to the project. There's a button at the top that says Analyze. So when we click on that Analyze button, there's a few things that we at VNL are still building, we're working on. So the systems map that you see right now doesn't filter quite the way that it's going to when we get it set up correctly. But this is where you'll get to see from a systems perspective, the people at a high level, what their needs are and where they're getting referred to. So we take the providers selections on suggested for you, and then we put that into this map so that you can track from a population level where people are getting referred, what needs they have, and you can see it visually. We do provide a GIS component to this that allows us to go kind of in depth into the location of resources and people. And we have some county health ranking data in here, but you can bring in different things that can help you do maybe some exploratory look at your data, especially from a population level. So at the systems level, this is the kind of stuff that's really helpful. There's just ways to kind of provide scores around different resources or people and things like that. And that's what happens on this screen. And then the charts and graphs screen allows us to do things like look at answers from a high level. So this right here was the question, which of the following are your most pressing concerns at this time? And that allows us to see what people said, for example, in this sample, food, followed by emergency needs. So at any point in your tenure of using this, you can come over here, and this is an active always updating set of information and data. And we're always introducing new features into this. Very shortly, you'll see cross tabs, and then our longitudinal analysis is something else that we're bringing in really soon. But anything that you customize in your screener is going to pop up over here. So we do our screener customization in these features right here, manage our members and including patients and resources here. And then we do our analysis from here, and it's all connected. So you'll be able to see that. And we do provide reports. They're not automated through the platform right now because with our pilots, we're creating individual reports for each of these sites, and then they'll give us feedback on them, and then we'll program them in here. So that's kind of a pretty high level of how the platform works. And you've heard a few things from some folks who are using it. I just want to make sure if anyone does have any other questions or comments that we can address them. And if not, that's okay. I will suggest that if you're interested in what we're doing and how we're to use this tool, there's a number of ways that we can kind of walk you through that. And you'll see Kelly, who's on this call, is a great contact for that, and the person who helps to guide people through the process.